Dear viewers, welcome you all to our show OSA, that is Orthopaedic Solution Academy. Hope you all are well with your friends, family, and your patients. Dear viewers, today our topic is a very challenging topic, that is the pylon fracture, that is managed by Ilizarov. And the speaker is the one and only, the legendary Ilizarov surgeon from Bangladesh, Professor Mofakhkharul Bari, sir. I would like to request Professor Mofakhkharul Bari, sir, to join with us.
Yes, good afternoon, everyone. Thank you, Tanvir, for introducing me.
Good afternoon, sir. Thank you very much, sir, for joining with us. Dear viewers, we have learned academic expert with us. One of them is Professor Omar Barabi, sir, from Kurdistan. I would like to request Professor Omar, sir, to join with us.
Thank you so much. Good afternoon. Happy Friday, everyone. Happy Friday.
Good afternoon, sir. Dear viewers, we have another enthusiastic Ilizarov surgeon from Patna, India. There is Dr. Shamsul Huda, sir. I would like to request Dr. Shamsul Huda, sir, to join with us.
Thank you and welcome, Dr. Tanvir.
Good afternoon, sir. Thank you very much for joining with us. Dear viewers, we have another learned academic expert from Tajikistan. I would like to request Iskandar, sir, Professor Iskandar, sir, to join with us.
Good afternoon, sir. Thank you. Okay.
Good afternoon, sir. Thank you very much for joining with us. Dear viewers, we have another academic expert, that is Professor Novikov, sir, and he will join in the coming part of our program. Now, I would like to request our honorable speaker, Professor Mofakhkharul Bari, sir, to share his screen and start his presentation. Sir, would you please share your screen, sir?
Okay, thank you. Can you see my slide?
It's coming. Yes, sir.
Okay. Then, dear friends and my dear colleagues, today I would like to talk on the very important, very challenging topic, which is pylon fracture, how we can manage it by Ilizarov. Without Ilizarov, you can manage it, but by Ilizarov, how we can manage, I will show you the cases. So, Professor Ilizarov was always doing this Ilizarov technique, by his invention, the ankle fractures, especially the pylon fractures. And what is that? It comes from the French word for pestle. This is a tool used for crushing. In many pylon fractures, a high energy impact causes the injury. This is an intra-articular fracture of the distal tibia. These fractures make up 5 to 7% of all tibial fractures. The term pylons was first described by Desto in 1911, who linked the distal tibia to a pestle. In 1950, Bonin chose the term tibial platform fracture to denote a fracture of the vault or ceiling of the ankle joint. These fractures, the result of shear forces, vertical compression forces, are of course the combination of the two. These fractures are characterized by marked interarticular combination. Most of these fractures occur as a result of motor vehicle collision, in which the driver instinctively brakes before the collision. This fracture can also occur when a person falls and lands on the foot, which actually lowers the tibial pylon. Now, before going to put the diagnosis, we must know the signs and symptoms of this fracture. Experiencing intense pain in your lower leg and ankle. You must see the bruising, small and or skin blisters around the leg and the ankle. And of course, not being able to put weight on your injured leg. Now, if we think about the types of this classification, Rudy and Algor, they have classified into 3 types. Type 1, cleavage fracture of the distal tibia without displacement of the articular surface. Type 2, distal tibia fractures with significant articular incongruity. And the third one, articular incongruity with combination of the metaphysis of the tibia. Other classification systems have been created. The common theme is that the prognosis is worse for those fractures created by high energy trauma. You can see here the type 1, type 2, and 3. Look at the left one, undisplaced, split. Look at the middle one, displaced, and look at the third one, displayed and comminution. Now, how can you feel when you are getting pylon fracture? How painful is this? Very painful, and of course, debilitating injuries. And you can see here pain and inability to bear weight on the leg, that I told you earlier. And obviously, you'll see the deformity of the ankle joint, and you must have seen the swelling, which is occurs very quickly and be followed by the bruising. And now the following imaging test can be used to diagnose a pylon fracture. You must have the X-ray first and then CT scan. A CT scan uses multiple X-rays taken from the different angles of your body to produce detailed images. CT scan provides more detailed images than regular X-rays. Now you can see when you talk regarding the treatment of this pylon fracture, it only depends on several factors. These number one, number of the fractures, the pattern and type of the fracture, and the bones are displaced, and surrounding soft tissue swelling, such as the muscle, tendons, skin that are damaged, and overall health, and if you have other injuries. Now, the treatment options of the pylon tibial fractures are challenging for all orthopedic surgeons. If you have the options, I must say the options, many very invasive, that is the Ilizarov is the best option for me. And other including that, you can see non-operative treatment, open reduction, internal fixation, limited open reduction with external fixation, especially for the Ilizarov, by which you can go for the definitive treatment, and close reduction with external fixation. Regarding the Ilizarov external fixator, it is an excellent tool or method in treating pylon fractures, especially when adequately applied. Tensional small wires. You can play with the small wires, smooth wires and the olive wires, which gives a good stability to reduce fracture fragments. Now, I'd like to share my cases that I treated by Ilizarov. Look at these. Rudy Albert type 3, a 53 years old man. Look at the left side and look at the right side. And look at the x-ray here. Albert type 3, look at the x-ray. Look at the combination here and lower part of the fibula. Then look at the CT scan. Minutely, if you see the CT scan, dear friends, you can see here how much combination is here. This is Rudy Algot type 3. And then what I have done, you can see, this is your fibula. This is one olive from the medial side and back of the fibula. And this is, you can see, joint was distraction was given. And as a result, you can see the articular congruency of that same bone. And what I have done, look at this. One ring here with telescopic rods, and then one ring here. This was connected with the post, and for reduction of the bones, you can put the olive wires. Patient is in a standing condition, and this is, you can see here, before treatment, and only after 4 months of treatment. If you look at this medial malleolus, and look at this combination here, and this is the lateral view, you can see, and at the same time joint surface also. Now, this is pylon type 2, 58 years old male. Look at this again, dear friends, you can see the x-ray combination here, and articular surface, interarticular extension here, and the fibular fracture. This is AP, this is lateral view, this is the condition of the patient, and think about the age of the patient. So what I have done, look at this, one ring up, telescopic, and one ring here, one ring here. Look at this x-ray. I have put the correction of this one, 2 olives from this side. This is from the medial side, and just look at the ankle, and this is the comminuted part, which is fixed by olive and smooth wires. So now look at this. This is before, this is after reduction, removal. Look at the lateral view, almost healed. Look at the joint survey, joint congruity, and this is the AP view, and this is the lateral view after the treatment. So look at the same patient after the full treatment. Now, another type 1, radial got type 1. Of course, you can open and you can go for screw fixation here and semitubular plate also. But here, I feel better to reduce by doing a one ring here, one ring top, and if you put a half ring in the calicinium, go for distraction without opening anything, you can reduce easily the bones, all this, here the crushed bones, by putting the olive, you could reduce easily. So this is the fracture, how you reduce. You can see one ring here, one ring here, then malleolus and fibula, and this combination was reduced by putting one olive from the medial side, and you can reduce the fibula by putting the another olive wire from the lateral side. So this is the AP view and this is the lateral view. When you're reducing, you must see the joint congruency of the ankle joint. Now look at this, and this is the half ring, and this is the half ring here in the calcaneum, putting back with the hinges, and then after removal of the, she's a doctor from Dubai, came to my place for treatment. Now look at this after treatment. This was bimalleolar fracture. This is only after 3 months of. Dear friends, I must tell you that you can easily reduce by this bimalleolus by olive wires. So look at this. Type 3 radial gout, open fracture. This is absolute indication for Ilizarov. Look at this X-ray. He was treated by AO fixator in one corporate hospital in our country, Apollo, and then they came to me with this, and then see, I have removed everything, and I played with only the smooth wires and the olive wires. I love to play with the small, smooth, biocompatible thin wires. And you can see here, from that situation to this situation, only after 2 months, because you are putting and you are going for distraction, that is arthrodiastasis by hinges, AHD by Ilizarov fixator. Now, dear friends, you can see again type 3. So very crushed injury you can see here. Look at this. If you open up, you can make a massacre. But whenever I think this kind of, I treated this one 2015, 7 years back. You can see here, that is 30 years old lady. And then CT scan. Again, CT scan, look at this. CT scan of different views. CT scan. And these are the intraarticular fractures. See, smiling lady, put the Ilizarov, and then I have reduced with biocompatible thin wires and olive wires. This is, you can reduce it easily, and you can see the axis. Axis is maintained well, and this is the fibula, and then from this situation to this situation only took 3 months, dear friends. Bimalleolar fracture with this lower end of the tibia, pylon, and at the same time intraarticular extension. Now, medial malleolus. Look at this. Medial malleolus of right angle, lower fibular dislocation, pylon, 50 years old. Look at this and look at this. What I did, lady. Again, I have fixed this one, 2 olives. Before that, I must put the one ring here, and how I reduce the fibula with olive, and then I put 2 olives under Shyam control, and then half ring in the calcaneum. And finally, I reduced, and you can see before treatment the position of the medial malleolus and the lateral malleolus, and this is after treatment of 4 months result. See, she's happy and it's okay. So, dear friends, now you can see again Pilon type 2 with motor vehicle collusion, 29 years old man. This is a severe case, dislocation also, medial malleolus, lateral malleolus, CT scan, and then what I have done, see, look at this, put the ring here, and then half ring here, reduction, reduced while by putting the olivers from this side, from the medial malleolus and from the lateral malleolus. And look at this, you can see that during treatment, one ring here with telescopic, one ring here, and then this is fixed to the post by putting the olive from the medial side and from the lateral side, lateral malleolus correction. And at the same time, you can see the situation of the ankle mortise and articular surface of the ankle mortise. See, if you draw a line, axis is maintained, and then this is the final situation here. Here you can see after removal of the dismounting of the Ilizarov apparatus. So this is a very bad case, reduced, patient is happy. So these are the things you can know. Where the vision is 1 year, you cultivate flower. But the vision is 10 years, cultivate trees. If your vision is eternity, cultivate people. Ilizarov surgeon or winners don't do different things, they do things differently. So, whenever this kind of pylon fractures or ankle fracture around the ankle, you can very nicely tackle with biocompatible thin verts by maintaining the principles and philosophy of the Ilizarov technique. I always say confidence is better than perfection. If you have a much confidence, then you can go for good perfection. Perfection means doing the best, and confidence means knowing how to handle the worst. And by Ilizarov technique, you can handle any kind of difficult things. So, what I showed, what I'm showing all the time by Ilizarov, of course, I have the evidence that I showed you, and everything based on science. Ilizarov is totally based on biological and mechanical, based on science. And of course, the surgeon who is handling this, he must have surgical skill. And thank you so much. Probably I could show you some difficult cases, and these are the cases that I've shown you. Thank you very much.
Thank you very much, sir, for your wonderful presentation. And now I would like to request our academic expert to share their knowledge. First, I would like to request Professor Iskander sir to say something regarding the presentation. Sir, would you please share your knowledge?
Говорите.
Bari, спасибо за хороший содержательный доклад. У меня несколько вопросов, Bari, сначала.
Да.
Вот.
He is asking me the questions. Okay.
Конечно, при таких осколчатых переломах как бы другой метод неприемлем. Вот каким образом добивается, под каким технологиям или под какой теорией производится репозиция этих отломков?
Да, хорошо. Значит, he is asking me the questions. Я сейчас перевод делаю, ему говорю, что я мне отвечаю, вопрос задавали. He is asking me the questions Why? By avoiding the other methods, how could you manage all this by Ilizarov technique? Then my answer is, Advait is, I told you, I have shown the different cases of difficult cases by Ilizarov technique under Shyam control. You can easily handle, you can reduce without opening anything. If you go for opening of these kinds of difficult cases, you may made massacre, because the lower end of the tibia, metaphyseal bones is covers, lower end of the covers the pilon, that is the roof of the lower end of the tibia above the talus. Whenever you are putting one ring here, putting below the half ring in the calcaneum, you go for distraction. Daioce vi distractio, значит вам получается reduction. We получите, you'll get the reduction of the bones, bag of bones. And from the medial side and from the lateral side, if you put the olive wires 1.8 or 1.5, depending upon your bone fragments, then you can reduce usually the medial malleolus, medially periladishak, laterally ladishak, lateral malleolus. So these are the techniques that you can put the two rings up, half ring below, give the distraction, and after looking the Shyam, you can put the olive wires from the medial side and from the lateral side. And of course, from the lateral side, if you need, you can put different olive wires. By this way, you can easily reduce all the fragments. And from day 1 or day 2, after 2 or 3 days, you can allow your patient go for movement. And mobility is the very important part of this Ilizarov technology. And fundamental principle of Ilizarov methodology is load and motion. You can put gradually you can tell your patient that you go for loading, partial, and gradually you increase your load and movement. And that will go for healing of the bones. Thank you so much.
Thank you very much, sir, for your nice answer. Now, I would like to request Professor Omar, sir, to share his knowledge regarding the presentation, sir, please.
Thank you so much. Thank you so much. Really, I congratulate my friend. I totally agree with him that Ilizarov method is the best method for intra-articular fractures of the lower end of tibia. As you know, that principles of treatment of any fracture is reduce, hold, exercise. But we can add one of the important point from Ilizarov method is that not only reduction and hold, preserve blood supply. Preservation of blood supply is very important for early healing and without introducing implant and without introducing any microorganism. That is the main point of Ilizarov method for successful treatment of intra-articular fractures, preservation of blood supply. Thank you so much.
Thank you very much, sir, for giving us nice tips. Now, I would like to request Dr. Shamsul Huda, sir, to share his knowledge. Dr. Shamsul Huda, sir, would you please?
Yeah, thank you, Dr. Afternoon. Thanks, Bari sir, for such a wonderful clinical cases of Pilon fractures. Yes, I agree that in our regular clinical fractures, we can regularly apply plates, nails, and screws in all the cases, all the trauma cases. But there are several cases, like there are blisters, there are swellings, there are compound injuries. The plating is not possible. And if we apply H6, it will be stiff ankle. So here, the role of Ilizarov becomes very important, and I've been doing Ilizarov in most of the ankle and foot injuries, in the normal primary fractures. The main the benefit, as Dr. Bari says, that we cannot do a distraction in plating. So here, Ilizarov, if you apply a calcaneal ring, also it's a very good distraction. There is a replaced fracture of the pylon, the tibal pylon. It gives a very good intra-articular congruity. So here, the one thing is it gives a joint distraction and very good reduction. Number 2, we can apply oblique olive wires that works as malleolar screws in all the directions. Malleolar screws can be done in 1 or 2 directions. So Ilizarov gives a circumferential reduction. That is very important. And third, as Marisa said, we can mobilize the patient next day only, even if there is compounding. So it gives a very good healing. So since long, I've been using Ilizarov on most of the Pilon fractures, calcaneal fractures. It's a very good rule.
Thank you very much, sir, for
Thank you.
sharing your knowledge.
Thank you. Very good.
Sir, I want to ask a question, sir. In your cases, you have shown that in some cases you have placed a housing in metatarsal bone. When you place this housing in metatarsal bone, when we use this housing, sir, is it necessary all the time?
See, not all the time. If you put the half-ring in the metatarsal bones and if you put the half-ring in the calcaneum, there is a balancing between these two. You know, that is the forefoot. You are balancing, you are holding, you are giving stability by half-ring, and you are giving stability by putting the half-ring in the calcaneum. It gives stability. Otherwise, there is a problem in the movement. Okay.
Yes, sir. Sir, one more question, sir.
Any question by?
Sir, if the
Sorry.
displacement, if there is more comminution, how much displacement you accept?
In the ankle joint?
Yes, sir.
Displacement of what? Fragments?
Yes, the comminuted fragment.
Comminuted fragment that I have seen I've shown you the most of the comminution. Difficult cases I've shown you in the lower one-third of the tibia. If you go for destruction by putting, I am telling you, these fragments with intracapsular, it doesn't, make any displacement while you are giving destruction. Rather, it comes together. And by seeing the fragments, how it is displaced, you can put the olive wires, 1.5 or 1.8, and easily you can reduce the display fracture by putting the olive wires. And it gives very good result. You can go for AO people, they're always doing opening, And I have seen the open fractures of Rudy Algot type 3. Lots of the cases I have seen, I have shown one case that whenever you're going for this big type of, external fixator with pins, you may invite the infection. Lots of the cases that I've seen when you are opening, you are doing massacre in the lower end of the tibia, and by putting the plates, you can invite infection. But here, even if your fragments is not well reduced, you cannot invite any kind of infection by doing the Ilizarov. That's why I think this is the best option in case of pylon fractures. Ilizarov is a very good option, I tell you. Before that, not only that, I did a lot of cases in Nichor by putting this semitubular plates by screws. I feel better whenever Ilizarov is in my hand. It gives a very good result. Outcome is very good. Okay.
Sir, according to the Ilizarov principle, sir, how far distance we have to maintain between the joint and the last smooth wire, joint line and the last smooth wire?
See, Ilizarov advantage, modular, customizable, can treat multi-level, multiplanar deformity correction, and last one is can articulate across the joint. If you put the wire through the joint, it doesn't help. This is the advantage of Ilizarov. Even then, if you see that you are facing problem, you can put the fracture area, a little bit fracture area, this is your fracture area, and top of that, even then half centimeter, you can put the Ilizarov wires from that fracture area. And distally, whenever we're putting the wires through the calcaneum, you make the destruction, and then you will have a very good alignment. If you see some displacement, then you can put the olive wires. Even then, simple K wires you can put, you can reduce their small fragments. And it gives a very good result, I tell you. Okay?
Yes, thank you very much, sir. Sir, what is the rehab protocol? Do you use any dynamization before removing?
Fundamental principle I told you is Ilizarov methodology is load and movement, and movement. By malleolar fracture, you go for 2 months. Unimalleolar, 1 month. Trimalleolar, 3 months. And if your combination is more than that, you can go for 3.5 and 4 months. 4 months don't need. 2.5 months and 3 months you remove your, dismount your apparatus, then gradually you go for physiotherapy. And we have a very good physiotherapist, and we have a apparatus, and I have in my center now the Russian physiotherapist and our Bangladeshi physiotherapist. They are doing accordingly, according to their method. My physiotherapist is from Uzbekistan. She's working here. Nurse physiotherapist is from Tashkent, Professor Iskandar. Anna Rabot, some know is this. She's working with me here. So rehab protocol is very important. Exercises, then wax therapy, then gradual exercises, stimulation, electrostimulation, ultrasound therapy. Then we are going for electrophoresis. Electrophoresis apparatus, this time I've taken from Tashkent. With these you can use. We don't have electrophoresis in my country. I took it from Tashkent. And we are using this electrophoresis. It gives very good result by mobilizing the muscles, joints, and strengthen the muscles around the ankle. I am using the electrophoresis. That is called electrophoresis. Okay.
Okay, thank you very much, sir, for giving us some nice informations. I would like to thank our honorable speaker for his wonderful speech and our academic expert for sharing their knowledge, and definitely Raj TV and Maria CNT Specialized Hospital for sponsoring our program and for helping us to arrange this type of academic program. I'm Dr. Tanvir saying bye-bye today. Hope we will connect you in the coming Friday with another topic. Till then, I would like to say bye-bye to all of you. Bye-bye.
Bye-bye. Goodbye.
Thank you.
You are watching Raj TV, Jagorone, Bangladesh. Please subscribe our channel.
Tanvir.
Sir.
Professor Iskandar.
Да.
Следующий раз хотите говорить?
В следующий раз
Пятницу.
у меня